Hello everyone, my name is Muftauddin Idrisu and my presentation is titled How Well Do We Know Wellens? Wellens syndrome is a pattern of electrocardiographic T-wave changes that is associated with critical left anterior descending artery stenosis. Even though it was first described in the 1980s, it continues to be under-recognized by clinicians and carries a significant risk of mortality if not intervened timely. We describe the case of an elderly woman with chest pain and classic EKG pattern that went unnoticed during an encounter with a primary care physician. A 70-year-old Mandarin-speaking female with past medical history of hypertension presented to her primary care physician complaining of a week-long history of shortness of breath and exertional chest pain. She reported taking aspirin and Chinese herbs to alleviate the pain without significant improvement. At the PCP's office, cardiac enzyme markers were within normal or reference range. Her electrocardiogram, as shown here in figure 1, was read as unremarkable. The patient was therefore recommended to continue taking the aspirin and follow up for an outpatient stress echocardiogram. On the day of the stress test, a resting transthoracic echocardiogram showed akinesis and aneurysmal deformity of the entire apical myocardium and akinesis of the mid-apical anteroseptal myocardium. She was immediately transferred to our emergency department for emergent cardiac catheterization. Her preoperative workup was significant for elevated troponin levels in an EKG notable for biphasic T-wave patterns in leads V1 to V4, consistent with Wellens' sign. A chart review showed that this sign was evident in the patient's EKG during her encounter with her PCP. So, if you look carefully here, you can see the biphasic T waves. The left heart catheterization confirmed severe stenosis of the LAD, 99%, in the circumflex artery. So as seen here in figure 2, see how the narrowing of the LAD? Drug-eluting stents were placed in the mid-LAD and the mid-circumflex artery. So now we can clearly see here figure 3, how patent the LAD is after the stents were placed. She was discharged home the next day in a stable condition with instructions to follow up with cardiology. So, Wellens syndrome, also known as the anterior descending T-wave syndrome, is considered a pre-infarction stage of coronary artery disease. It makes up about 10 to 15% of all coronary syndromes in the United States. What are therefore the diagnostic criteria? This includes a recent history of angina and also the characteristic T-wave changes, which are two main types. The first one is deeply inverted T-waves in these V2 and V3. This is sometimes called type B Wellens syndrome. It makes up about 75% of the cases. Another form of T-wave changes is the biphasic T-waves with initial positivity and terminal negativity, as seen here. This is also known as type A Wellens syndrome. It makes up the rest of the 25%. The rest of the criteria includes a normal or slightly elevated cardiac markers, no pathology precordial Q waves, preservation of precordial airway progression. Urgent coronary angiogram is recommended whenever Wellens syndrome is suspected. A stress test should be avoided because it can lead to adverse events with fatal outcomes. Thank you very much for your time.